My project proposal is on the benefit of having Band 4 assistant practitioners in cardiac rehabilitation to decrease waiting times from hospital discharge to starting phase 3. The aim of this project is within 1 year, Band 4 assistant practitioners to be part of the MDT that can help with initial assessments, discharges, taking exercise classes and gym classes to reduce the time the patients are waiting post-discharge to start in phase 3 from 10 weeks to 6 weeks if the patient meets the criteria. So who will the stakeholders be? The patients themselves, physiotherapists, assistant practitioners, cardiac nurses, doctors, consultants, other MDT members such as dietitians, psychologists, social workers, occupational therapists, and pharmacy. And then the friends and family of the patient. So cardiac rehabilitation is a service offered to patients with heart disease which improves their functional capacity, well-being, and health-related quality. The people I was seeing when I was in cardiac rehab were people who have had a cardiac event, who are no longer in hospital, but are keen to build up their fitness and knowledge with supervision by coming to a circuit-based exercise class, an external gym, or just wanting more information about lifestyle changes. So why do we need this change? Long wait times are going to lead to reduced quality of care, pain, stress, anxiety, and lack of confidence in the health service. Other initiatives have been used in the NHS to improve patient flow, such as triage, which has been successful. 65% of programmes experience staff loss, and 27% of these staff posts were not replaced since COVID-19. And in June 2022, the British Heart Foundation stated that 5,083 people were waiting for an outpatient cardiac appointment, which is 9 times higher than pre-pandemic. The key stakeholders might be a bit apprehensive about the Band 4s taking on such a big responsibility, but with the right training and a plan in place that every professional is happy with, this can help out other bands and professionals with workload and give patients the care they deserve. In a meeting, it will be presented to them, along with statistics of wait times and the effect of these, clearly state what roles the Band 4s will have and what they won't be able to do, and allow stakeholders to voice any concerns, which will be met with adequate knowledge to show that these won't be an issue. The tool that will be used to improve is the PDS cycle, which has been used in healthcare to make improvements as it started with few patients and change can be done very quickly. The benefit of using this tool is it allows small changes to be made, the data gets collected, and then the changes can be made before on a bigger scale. So the plan is to discuss in an MDT meeting what roles the Band 4s will be taking on, what hiring criteria, for example, their experience and qualifications, and how they're going to be trained. Then we'll decide who is training the Band 4s and how this is going to come about. Collect the data on wait times to compare at a later stage to measure the success of reducing the wait times. Create a questionnaire for the patients who have had their assessment with a Band 4 to gather feedback. Then we're going to organise a meeting with appropriate managers at NHS to ask for funding for the roles and support the Band 4s by having weekly meetings so they can voice any concerns and struggles. For the study aspect, we're going to decide if the Band 4s is helpful enough to justify the effort of training them by looking at the data collected from the wait times and find any solutions to problems that occurred during this. If successful in reducing the wait times, we'll put forward the evidence with the intention of Band 4s having a permanent post and even hiring more, and have a meeting with the MDT and the Band 4s to see if anything needs to change to improve the service even more. Our outcomes are going to be to reduce the wait time for initial assessment and starting cardiac rehab, to reduce the chance of patients having another cardiac event by living a healthy lifestyle. This is going to be measured by gathering the data on wait times and to ask the MDTs if their workload has reduced. And this is a list of the references that I used during this. Thank you.